Okay, another day for another set of ANKI cards. This one is for the Immunology and Serology, the second to the last topic, Autoimmunity. I hope I can also put in the histopathology cards. So I hope I finish this for today. So let's start now. This one is not written in the 5th edition, but this was written in the 4th edition. So yeah, lymphoma. I gotta look for it first. Uh-huh. Okay, so it's lymphoid proliferation. 41-year-old man presents with fatigue, hypotension, hyperpigmentation. Laboratory findings show low cortisol, elevated ACTH, anti-adrenal cortical antibodies. Yeah, Addison's disease. It's anti-adrenal cortical. So, a 33-year-old man develops autoimmune myocarditis following Coxsackie virus infection. The inflammatory response initially targets viral proteins but later spreads to cardiac myosin antigens. Which mechanism described in the text explains this shift? Superantigen, cryptic antigens. No, it's not UV. I think it's molecular mimicry. What? Stress body after tissue. Oh, okay. It's not molecular mimicry. Alright, copy that. Monoclonal antibody, tumor necrosis factor alpha. Yeah, this one. 41-year-old woman presents with weight gain, fatigue, and cold intolerance. Her thyroid is diffusely enlarged, but not tender. Elevated TSH. D4. This is not trap cycle, I hope. I hope it's TPO. Right, I'm correct. Because this one is the other one. This is for the hyperthyroidism or the Graves' disease. This one. This is for your myasthenia gravis. I don't know that. 33-year-old man develops autoimmune myocarditis following Coxsackie. Alright, epitope spreading. Especially, it's not mimicry because it's, 13-year-old boy presents with polyuria, polydipsia, and weight loss. Laboratory testing reveals hyperglycemia, low C-peptide, and circulating. This is type 1 diabetes. Yeah, that one. 44-year-old woman develops lupus after chronic exposure to ultraviolet radiation. Her physician explained the DNA released from damaged cells. Yeah, cryptic antigens. It's released after UV. 38-year-old man develops inflammatory arthritis, conjunctivitis, and urethritis following an episode of dysentery caused by Shigella flexneri. Laboratory testing shows HLA-B27 positivity. So this for the rheumatoid arthritis. So okay, no. Oh, reactive arthritis. For a while. Reactive arthritis. For a while. HLA. There you go. So investigators found the association between the presence of certain human leukocyte antigens and ankylosing spondylitis. Okay. Alright. Post-infectious inflammatory trichomoniasis. Okay. Reiter syndrome. Oh, okay. So if it's micro, so it's not. This wasn't. This wasn't mentioned in the chapter, but when you're looking at the Shigella flexneri or anything bacterial, you have to go for the molecular mimicry. However, if there's a bystander effect and T cells are activated, you use epitope spreading. So it's noted. Any testing are using head to cells molecular staining pattern. Okay, don't know this. Oh, Sjogren syndrome. It's why is this not in the fifth ed, bro? So Sjogren syndrome. So the laboratory results nucleolar staining pattern. Okay, so it's nuclear pattern in DNA testing, antibodies to RNA. Alright. 31-year-old woman treated for lymphoma with immune checkpoint blockade develops hepatitis with high ALT and lymphocytic infiltration. Her T cells lack PD-1 expression, which explanation does not confirm. Yeah, that's the A. Persistent effector T cell PD-1 functions. PD-1 is the immune checkpoint. So you lose it, you're getting attacked by T cells. A 42-year-old woman presents with hypothyroidism and high titers of anti-thyroid peroxidase, anti-TPO, and anti-thyroglobulin antibodies. According to text, what is the most likely underlying disease mechanism? It's not. It's TPO, so it's not TRAB. So it's Hashimoto's thyroiditis. See, if it's in the thymus and bone marrow, that's your central tolerance. 26-year-old woman with recurrent spontaneous abortions is a prolonged partial. Okay, I know this. Does not correct with mixing studies. She also tests positive for anti-cardiolipin, antiphospholipid antibody syndrome. Laboratory tests reveal positivity for anti-U1 ribonucleoprotein antibodies. So the woman has joint pain, sclerodactyl, for a while. Pterodactyl and Zika symptoms. Laboratory tests reveal positivity for anti-RU1. So it's overlapped with lupus scleroderma and poliomyositis. Anti-U1. Mixed connective tissue disease. We'll have to go with that for a while. Mixed connective tissue disease. Oh, partial identity and nocturnally. Immunodeficiency, systemic sclerosis, Sjorgen syndrome. So mixed connective tissue disease. Found it. She's being treated with hydralazine, arthralgia, and positive ANA testing. Homogeneous pattern. Histones. So is it histones? I'm gonna go for Sjorgen syndrome, other diseases, but I think it's drug. Oh, okay, it's drug induced SLE. I forgot about it. 42-year-old woman systemic lupus erythematosus is treated with belimumab, a monoclonal antibody targeting B lymphocyte stimulator, BLYS, according to text. What is the therapeutic rationale for this treatment? So it's monoclonal B lymphocyte. I forgot. I don't know. I don't know though. Decreases survival of autoreactive B cells by blocking BFK. I'm gonna have to adjust. I need to finish this within the day, so I'm gonna have to take this to another level. So 180 and 10 minutes. Okay, a 42-year-old woman completes a fatigue dry mouth test positive for SSA row, SSB la. Okay, speckled ANA panel. Chronic B cell infection. Sjorgen's entry is lymphoma. Why is Sjorgen not here, bro? Okay, so okay, it's fine speckled pattern. Okay, it's a vascular. Um, lymphoid proliferation. Oh, okay. So it's in the inflammatory myopathies. So finely speckled. Oh, so Sjorgen is not mentioned. Okay, I got you. So 50-year-old female with rheumatoid arthritis is treated with monoclonal antibody. So it targets TNF. TNF is a major inflammatory. Laboratory finds low cortisol, elevated ACTH, and anti-adrenal cortical cell antibodies. Based on the text, which description best defines this low cortisol, elevated ACTH, and anti-adrenal. That's your Addison's disease. Weight gain, fatigue, and cold intolerance. Her thyroid is diffusely enlarged but non-tender. Elevated TSH and decreased VP. This has to be TRABS. Oh, no. It's hypo. Diffusely enlarged but non-tender. If it's your goiter, it's enlarged. So, elevated TSH. There's a table, elevated. That's your TPO, I think. The one with TPO and thyroglobulin. It's your Hashimoto's thyroiditis. It's the other way around for the Graves' disease. Okay, autoimmune myocarditis, Coxsackie virus infection. If it's a virus, it's your epitopes. Yeah, epitope. If it's your bacterial, it's your molecular mimicry. I'm. I don't think. I'm gonna have to review on this. Okay, microbial infections. That's your molecular mimicry. For the bystander effect, oh, okay. So, so I get it now. It initially targets the viral proteins, but later spreads. So that's called bystander effect, which is epitope spreading. So I get it now. A 13-year-old boy presents with polyuria, polydipsia, and weight loss. Laboratory testing reveals that's your type 1 diabetes. So, destruction of pancreatic B cells. DNA released from damage. That's your uh, cryptic antigens. Monoclonal antibody targeting B lymphocyte stimulator. So it's belimumab. So B lymphocyte stimulator decreases survival. BAFF. Automated serology screen for anti-nuclear antibodies. The test uses microscopic verified nuclear antigen produces colorimetry. So it's colorimetry. So let's say it's not Octerloni, it's Elisa. Yeah. 30-year-old man develops inflammatory arthritis, conjunctivitis. So it's Shigella. So it's a microbial. That has to be molecular mimicry. HLB27 positivity. Multiple polymorphism genes that affect T and B signaling and Treg maintenance. His genetic counselor knows a set of genes. Yeah, here. It's this one. We're looking for non-MHC genes. So we got PTPN 22, IL2RA, CTLA4, BLK, and ARE. Alright. For a while. Alright, I had to check for my. Okay. We're not yet halfway though. So which process occurs in the thymus and bone marrow? That's your central tolerance. Okay. Say, nucleolar staining pattern, systemic autoimmune disease. ANA testing using HEP2 and nucleolar for a while. Alright, RNA detectable systemic sclerosis. The nucleolar pattern Epstein-Barr virus. Okay. A 31-year-old woman treated for lymphoma with immune checkpoint blockade develops hepatitis with high ALT and lymphocytic infiltration. So PD1 is the loss of it, persistent effector T cell, of course. Sorry about that. I have to finish this for the whole day, cause I still have histopathology. For this one, I have to finish it, so I reset my settings for a while. Hypothyroidism. So your TPO is high and antithyroglobulin. As long as there is no TRAbs, you go for Hashimoto thyroiditis. So 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 prolonged thromboplastin time mixing studies does not correct antiocardiolipin. It's not Adam TS13, that would be your antiphospholipid antibody syndrome. That would be your ano. Yeah, anything antiphospholipid. Right, positivity for anti-U1, that would be your mixed connective tissue disease. Alright, mixed connective tissue disease anti-U1. So hydralazine develops arthralgia and positive AMA test. Immunofluorescence reveals a homogeneous pattern and a specific testing defects antibodies against histones. So histones is your and histones is the target. That would have to be your it's drug induced. There's hydralazine in here. I'm gonna have to add the table for a while. So it's hydralazine. Yep, here it is. No wait, sorry. This is why I love ANKI so much, bro. It's so modular. Unlike the other flashcards, other flashcard options you have. See this? So here it is. Antihistone, drug-induced SLE, and other diseases. So the receptor editing in B cells, basically that's how you safeguard your body from B cell reactivity. So it rearranges immunoglobulin genes. So we have a 30-year-old woman. Okay, we have fatigue and joint pain. ANA testing is positive, speckled pattern, and anti-U1 ribonucleoprotein antibodies. Connective tissue disease, that's mixed connective tissue. Right, systemic lupus erythematosus and non-DNA sequence, abnormal methylation patterns. Okay. It's not molecular mimicry. It's not central tolerance. It's not epitope spreading. Epigenetics. Yeah, it's for a while. Let me highlight that. So she's a 46. So it causes abnormal regulation of microRNAs. Okay, modifications in gene expression that are not caused by changes in the original DNA sequence. So it's non-DNA sequence changes. 35-year-old woman develops autoimmunity after infection. Researchers identify antibodies that recognize both bacterial antigens and host cardiac myosin. So autoimmunity, it's after infection. I want to go for the epitope spreading, but there's also I want to go with molecular mimicry for this one. Yeah. Cross reactivity. Streptococcus pyogenes. Alright. A 40-year-old woman presents with thickened facial skin claw-like hand deformities, and dysphagia due to esophageal fibrosis. Serologic testing reveals ANA with nucleolar pattern. Hmm. Nucleolar pattern. Claw hand deformities. Is it diffuse? Dude, I this is not good. I need to what part of the book is this? So it's part of the systemic. Okay, I'm gonna go for ANA. Nucleolar pattern. So it's systemic. Alright, here it is. Systemic sclerosis. Anti-SCL. And your anti-nucleolar pattern. Systemic sclerosis. Alright. Speckled patterns. Skin and blood vessels. So PM1 antigen. Alright. Excuse me. Okay. So she gets a rituximab therapy. It's it's a corticosteroid. It targets. Oh god, I want to go for CD20, but is it CD20? Yes. Postpartum woman develops neonatal lupus in her infant with transplacental passage of maternal antibodies. Yeah, here they. These are the SSA row and SSBLA. 47. Systemic loaded IL-6, ITNF, junction flare, connective system. Because fever, acute phase protein and B cell amplification. Okay, acute phase protein and B cell activation. Raynaud's phenomenon, calcinosis cutis, sclerodactyl, and telangiectasia. Discrete speckled pattern. I'm gonna go with anti-centromere. Yeah, anti-centromere antibody. Suspected autoimmune disease undergoes IAF and hepatocells. Discrete speckles, concentrated, so it's centromere. So crest. A 29-year-old woman develops progressive dyspnea and thickened skin on her fingers. Positive ANA and a typical speckled pattern and elevated SCL70. Nodular deposits of calcium. So it's SSC. I think I'm gonna go with SM antibodies. Oh, okay. For a while. SCL70. What is that for? SCL70. Oh, here it is. SCL70. Anti-SCL70. Systemic sclerosis. Oh, got it. Got it. Systemic sclerosis. DNA compound pattern. Yeah, compound pattern with speckling. Atypical speckled pattern, so compound pattern. Progressive ataxia neuropathy, glutamic acid carboxylase, and mild hyperglycemia. If it's your God, that's your type 1 diabetes. Double strand anti-dsDNA. Lupus nephritis. Increased citrullinated proteins is one. Alright. Is it this death of cells? So it's post-translational citrullination. Self-reactive B cells unresponsive in periphery. Energy? Oh, yeah, energy. So, a 38-year-old man with recurrent autoimmune episodes after viral infection demonstrates strong activation of autoreactive T cells and production of interferon A. His immunologist explains that this results from innate immune recognition of microbial mononucleic acids. Viral infection. Okay. Synovial syndrome class. Oh, right, here it is. Ankylosing spondylitis. I'm gonna go with B27. Yeah, it's simple. Different marketing concerning which type of affair responsible cytokine. Yeah. Oh, no, I don't want to go with this. I want to go with this one. Okay, plasmacytoid dendritic cells type 1 interference, not like anticyclic. That's your anticyclic. Worsening renal function and local clearance. Complete process being consumed by immune complex deposition. If decreased. There we go. C3 and C4. Sorry about that. We're not gonna move that away. No, I don't want to do that. So we have a 27-year-old. 27-year-old. Alright. Double-stranded DNA. Decreased serum. Ophthalmos. This is your Graves' disease. Palpitations, heat intolerance, and tremors. Goiter and exophthalmos. That's your TRABs. A 31-year-old woman is diagnosed with autoimmune thyroiditis after childbirth. So it's thyroiditis. Okay, estrogens. Pernicious anemia. So her thyroid studies reveal elevated TSH. increased at T4. So if elevated MTSH, this time, what? Oh, this is the one. Coexistence Hashimoto's. So this is not the right answer. It's your A. I gotta change that. Blocks PD1. Inhibitory signal. Painless thyroid enlargement. Graves disease. Binds of apoptosis. Erythema nodosum uveitis and ANKI negative. 17 and 23. Beckett disease. Viral infection, toll-like receptors, viral nucleic acids, enhanced production of interferon alpha, autoreactive B cell activity. So, yeah, pattern recognition. Systemic lymphocytosis is noted to have elevated This is your acute. This is your acute phase reaction. Sorry about that. Lupus flare, sun exposure, viral infection. I mean, yeah, genetics. High serum titers, rheumatoid factor, and anti-CCP. Yeah, that's your C. Or D-Day. What? Oh, I forgot. CTLA4, is this the central tolerance? Oh, peripheral tolerance. So we have a diagnosis, antibody pair. Goodpasture syndrome. So this C, Hashimoto's. Can I check it? Check some out. What? Hashimoto's has. Alright. This is Graves' disease. Intrinsic factor antibody. Oh, okay. I got you. I found it. It's in the table. So, parietal cell antibody, intrinsic factor antibody, that's your for pernicious anemia and stomach. Okay. Progressive dyspnea thickened skin, positive ang ANA with atypical speckled. Okay, atypical speckled, that has to be diffuse. Infection is believed to have activated autoreactive thyroiditis, autoimmune thyroiditis, from hepatitis. That has to be superantigen. Oh, no. Bystander activation. Worsening fatigue, anti-dyspnea, antiferal marketase, that's your plasmacytoid dendritic cell anti-inflammation. Organ specific, autoimmune disease stable. Myasthenic, fluctuating pulse, diplopia. Myasthenia gravis, so acetylcholine, musk. Elevated. Was it inhibit? Oh, fibroblasts. Great. Atypical speckled inert is directed against DNA. I know this. DNA topoisomerase 1. Yeah, SSC. Yeah, found it. I knew it. There you are. DNA topoisomerase 1. It's anti-SCL70. Okay. Anti-DNA topoisomerase compound. Positive anti-transglutaminase and anti-endomysial antibodies. Oh. Is this celiac disease? Yeah. Crohn's disease, anti-Saccharomyces cerevisiae. Alright, so your Crohn's disease is... Here they are. The missing antibodies, DG plus TTG. Where is it? Dude, the tables are not complete in here. I don't know why. What's wrong with my book? sex hormones favor immune pathways predisposing to such disorders. Has to be estrogen. It has to be. Right. Peripheral neuropathy and purpura, P-ANKA, and reacting to myeloperoxidase. Immunal biopsy is immune. This is degranulation of primed neutrophils. Yeah, it's too obvious, but why haven't I covered this actually? Dude. There's a table for this. Here you are. Fluorescence surrounding lobes of the neutral line blending together. MPA. Okay. Painless thyroid. Decreased serum thyroxine. That's your Hashimoto. So destruction. Yeah. Mild jaundice, liver biopsy, portal inflammation, bile duct destruction, antimitochondrial, yeah, cytotoxic. It's antibody. Damn. 48-year-old man with vasculitis undergoes testing for anti-neutrophil cytoplasmic bodies using both IIF and antigen-specific immunoassay. IIF shows cytoplasmic. ELISA is negative PR3 LPO. What is this? I don't know. False positive. Oh, okay. Bone marrow. Oh, defective. So thymus. Gym. The ability of the immune system to recognize self-antigens and remain unresponsive is self-tolerance. 58-year-old man with rheumatoid arthritis develops vasculitic skin lesions and peripheral neuropathy. High rheumatoid factor circulating immune systems. This is your deposition. Excuse me. Hydralazine and procainamide. Histone acetylation. Why do I forget CTLA4 is for peripheral tolerance? Nephritis and serositis. Immune complex deposition in glomeruli and serosal membranes is observed. That's your good pastures. Right, another wrong. Okay, that's anti-SCL70. Basta SSC ng pagstoryahan. Alkaline phosphatase and autoimmune hepatitis. Okay, primary biliary cholangitis. Progressive destruction and enterohepatic cholestatis. Serum alkaline phosphatase level elevated at least 1.5 liver by destruction of cholangitis. Alright. Macrocytic anemia, that's your pernicious anemia, parietal cell intrinsic factor. Affected of that is your stomach. Undergoes ANA testing. You have two substrate reports peripheral rim staining. Rim. What is the... Why are these cards so obvious? Okay, dry eyes, recurrent parotid. Here, parotid. Fine speckles, anti-Rho, anti-La. Yeah, that's your B-cell lymphoma. Sjorgen syndrome or by B-cell lymphoma, persistent glandular. Sjorgen syndrome. I have to look for that again. Negative ANA screened by IIF, the rheumatologist asks about the test's limitations and sensitivity. Negative ANA 40 patterns. Oh, alright. I just realized my IS book is filled with a lot of notes. Thyroiditis, recovering from viral hepatitis. That's your bystander activation. Infection-induced leukocytes release cytokines that non-specifically activate. Alright, diffuse form, TGFB, that would be your fibroblast proliferation. Near's elbows. Histologic examination shows central fibrinoid necrosis surrounded by palisading. Okay. Palisading histiocytes. That's not fibroblast, I'm sure. Palisading histiocytes. I want to go with granulomatous inflammation. I don't think so. I think it's the deposition. It's deposition, yeah. Fine speckled pattern. Rho, La. Secondary condition is your... Anti-Rho, anti-La. Is this... So, bilateral parotid enlargement. Parotid enlargement. I wanna go with... Damn, I don't... So she's positive for ANA, fine speckled patterns, anti-Ro. I wanna go with systemic sclerosis. What? Oh, it's secondary. Secondary. Got it. Antibodies to a family of small uridine-rich RNAs complex to proteins. So rheumatology suggests evaluating for disorders that commonly show this antibody. So small uridine U1. Isn't the ENAs? CTLA4, I think. Yeah. If I could be. Rheumatoid arthritis. Synovial biopsy reveals granulation tissue invading cartilage and bone, which term best describes the pathologic issue. Has to be the panus. Alright, I did not mean to do that. Stereodactyly, esophageal dysmotility, telangiectasia, and anti-centromere antibodies. Normal pulmonary function. If there's sclerodactyl, that's the crest. Direct antiglobulin test is positive. Elevated ANA, homogeneous pattern. Anti-dsDNA are both present, but anti-SM is negative. I'm gonna go. So that's cancelled. Eagle is cancelled. A is cancelled. Subacute cancelled. It's drug induced. Yeah, drug induced SLE antihistone. Anti-SM is for your SLE with core speckled. NA positivity and elevated dsDNA positive anti-SM. So this one retested during emission A nitrogen positive, but dsDNA titers normalize. I think the longest answer is the correct one. 39-year-old woman suspected systemic lupus erythematosus with discordant test results. Positive ANA but IIF, but by IIF negative anti-dsDNA. Go to the text, which explanation? It's so ANA is positive, anti-dsDNA negative. Yeah, ANA detects a broader range of nuclear antigen anti-dsDNA. Fatigue, nausea, portal inflammation, receives positive antimicrobial. That's your autoantibody mediated destruction. As long as it's PBC, anti-antibody. Dude. For a while. So both IIF and antigen specific. How am I gonna survive? Si ANKA, Lisa is negative for PRT and MPL. False positive. I need to review that. I haven't read about that, or I forgot about it. Initial testing with IAF. Oh my gosh. Genetic testing reveals a mutation in LCTLA4 inhibiting that's peripheral tolerance CTLA4. Alkaline phosphatase, anti-mitochondrial antibodies. Let's go with your. Yes, I'm gonna go with PBC. Primary biliary, yes. Chest pain, dyspnea, echocardiography reveals sterile vegetations on the cardiac valves without infection. Sterile vegetations. What does that mean, bro? Sorry if I'm not talking, I just wanna finish to 100 flashcards. I wanna narrow it down to 100 flashcards. We have discrete fluorescent ring localized to the kinetoplast. Creatia lucili. For a while. Have I read about this? Whoa. Oh, it does exist. Ah, it's immunofluorescence. Okay. Direct fluorescent ring. Overlap. This is absolutely an overlap. So tired. Rim. A rim. There's a rim. 13 fatigue. A peripheral rim immunofluorescent pattern. I wanna go with anti-RNP. Damn. So we need a rim for your anti-DS DNA. Anti-DS DNA with binding to kinetopas DNA and a protozoan substrate. Just notice it's a protozoan. Ethanol fixed neutrophils show diffuse region. Okay. Diffuse granular. What table is that? Mm-hmm. Oh, it exists. Oh, it's in ANKA. Okay. Why did I not read about this? Okay, last taste antigen, EGP. Oh, granulomatosis with meningitis. It's PR3. Oh my gosh, here it is. Microscopic cholangitis. Fine speckled pattern. That's your rheumatoid arthritis kasi secondary siya sa SLA or Sjogren's syndrome. Oh god. 20-year-old U1 next connective tissue disease. I'm gonna go with regulation. Yes. Peripheral T cell tolerance. If it's peripheral, is this one? Yeah, energy. It's not systemic. Skin. I knew it. It's why is this not systemic? It's scleroderma. Sorry. Cross reactivity between streptococcal and cardiac. That's your molecular mimicry. And dry foods. That would be your lymphocytic infiltration. That's your pernicious anemia. $17. 3 months. That's your question, I think. Sorry if I'm silent right now. I really need to finish this out, so I'm gonna have to speed run all of this. Oh, alright. That's your ITP. Yes. Oh, okay. Discrete skirt background pattern. PR3. PR3. Oh my god, finally. Oh, finally. Alright, that is it for today. Finally finished it. Thank you for being with me. So this is the Immunology and Serology Autoimmunity chapter. So after this, I'm gonna have to get the rest. I will then um I'm gonna have to re redo everything. And I'm talking not only about um one chapter. I need all the chapters to be finished because this is a comprehensive exam I'm preparing for, like this one. Antigen and antibody, immunoglobulins and glycoproteins that are composed of. See, I forgot about this. So I'm not. This is not um Okay, I think it's I think it's important too. 0.001%, 1 to 3 days, delta along 58 amino acid. Mm-hmm. J chain, cells. IgG3. Oh, okay. IgG2. Hinge region. Alright, that's it for today. Thank you for being with me.